In this presentation, we're going to be talking about hepatitis B, and this is by Amanjit and Dimlulua. What is hepatitis? The word hepatitis means inflammation of the liver. This condition can be caused by certain medical conditions, drugs, and alcohol usage. In most cases, it's caused by a virus, and it's known as viral hepatitis. The most common types of hepatitis are hepatitis A, B, and C. Now we're going to be talking about what is hepatitis B. Hepatitis B is a serious infectious liver disease which is caused by hepatitis B virus, which is also known as HBV. The virus affects the liver cells, also known as hepatocytes, and can lead to further complications like liver cancer, Crohn's, or liver failure. What is the normal physiology? The liver is a large organ weighing about 3 pounds situated behind the ribs in the abdomen's upper right-hand corner. The central functioning units of the liver are called hepatic lobes. Each lobe is made up of millions of hepatic cells called hepatocytes. In the next slide, I'm going to be talking about the functions of the liver. The normal physiology continuation. Now I'm going to be talking about the functions of the liver. The liver has so many functions. They could be used for regulation, for protection, for synthesis, and for also storage. Now let's talk about for regulation. The liver maintains the serum level of glucose, triglycerides, and cholesterol in the body. For protection, they break down and detoxify chemicals and harmful substances and help in metabolism of medication. They are also used for synthesis. The liver synthesizes bile, a green-yellowish thick fluid which aids in the absorption and digestion of cholesterol and fat. The liver is a communal area for fat-soluble vitamins that are used to treat cholesterol homeostasis. It plays a significant role in clotting factors and protein synthesis. The liver plays a role in the synthesis of sex hormones and produces protein carriers that are essential for reproduction and growth. They're also used for storage. They help us to store iron and fat-soluble vitamins. Now, I'm going to be talking about the modes of transmission. How does the virus spread? The virus can spread through contaminated blood and bodily fluids, direct blood-to-blood contact, unprotected sexual intercourse, and an infected mother to a child during pregnancy and childbirth. Signs and symptoms. Hepatitis B signs and symptoms may include abdominal pain, dark urine, fever that persists for weeks or months, joint pain, weakness and fatigue, loss of appetite, nausea and vomiting, yellowing of the skin and white of your eyes, which is also known as jaundice.
Risk factors. Having unprotected sex with multiple sex partners or with someone who is already infected with the infection. Sharing of needles during IV drug use. Men having sex with men. Or living with someone who has chronic hepatitis B infection. An infant born to an infected mother is also at risk. Having a job that exposes you to human blood can also pose a risk for hepatitis B infection.
Pathophysiology. Hepatitis B is an autoimmune disease of the liver. The hepatitis B disorder occurs only if virus can enter the bloodstream and then penetrate the liver. The virus has an outer coating and an inner core. The outer coating of the virus has a surface protein known as hepatitis B surface antigen. And the inner core includes hepatitis B core antigen, which contains DNA of the virus and enzymes that are needed for virus replication. Virus enters the liver through the bloodstream and invades liver cells. Once it is inside the cell, the virus replicates and starts making copies of itself and releases many viruses into the bloodstream. These newly produced viruses then enter and infect other liver cells and repeat the replication process. Hepatitis B virus itself does not cause the destruction of the hepatocytes. The actual damage occurs as a result of an immune response carried out by cytotoxic cells of the body. Antigen-presenting cells present the foreign antigens of virus on their major histocompatibility complex class 1 protein. The body's immune system recognizes these foreign antigens and mounts a cell-mediated adaptive immune response against them. As a result, cytotoxic T cells get activated to clear the virus and kills these infected hepatocytes by releasing toxins into these cells. The damage to liver cells is followed by cell repair and tissue scarring, also known as cirrhosis, as a part of the repair process. This condition can ultimately lead to liver cancer and liver failure.
Symptoms related to the disease. The destroyed liver cells release bilirubin and bile salts into the bloodstream. They fill the tissue and give a yellow color to the skin and lead to a condition known as jaundice. The bile salts also penetrate the skin and cause itching. The kidneys filter extra bilirubin from the blood and excrete it in the urine, giving the urine a dark color. Current research. The International Coalition to Eradicate Hepatitis B is a network of experts committed to finding a cure for hepatitis B as soon as possible. It has proposed two strategies to find a cure. The first one is to cure the infection without destroying infected cells, and the second one is to promote immune control to safely remove infected cells. Although an efficient vaccine exists for the hepatitis B virus and it has helped in the reduction of the virus, the vaccine's coverage is still low in many parts of the world. Therefore, the availability of the vaccine needs to be expanded in all parts of the world, especially in low and middle income countries.
Diagnosis for hepatitis B. Blood tests can be done to confirm the presence of hepatitis B surface antigen and hepatitis B core antigen. It can also inform you whether you are immune to hepatitis B virus or not. Abdominal ultrasound is another option which can be used to see size and shape of the liver as well as blood flowing to it. Liver biopsy can also be done where a small sample of liver tissue is taken and sent to the lab for examination. Treatments for hepatitis B. For acute hepatitis B, the doctor will typically tell you to get a lot of rest, drink plenty of fluids, and follow a balanced diet to help the body fight infections. When the infection persists for more than 6 months, it can lead to chronic hepatitis B. The drug therapy is used and antiviral medications are given to the patient. Liver transplant is another option which can be done when the liver is damaged too much and cannot function properly.